Thanks, Jimmy. Good afternoon, everybody. Thanks very much indeed for joining us. We've had a meeting this morning of the Greater Manchester COVID Emergency Committee, and we wanted obviously to update you on the back of that. I'm joined today by Professor Kate Ardern, who is the Lead Director of Public Health for Greater Manchester, and Kate will give you her view on the figures that we're about to present. I'll also raise a couple of particular issues of concern that are topical. But just to begin, it was important that we did meet today because the general feeling is that there's a challenging autumn and winter ahead of us. And of course, the Prime Minister made his announcements yesterday with regard to the plan for the coming period. I was in Manchester Foundation Trust yesterday, and certainly I think it's true to say that NHS colleagues are braced for a difficult time. Because of the measures taken last year to prevent the spread of COVID, they also had the effect of suppressing the normal flu season and seasonal viruses like norovirus. And the consequence of that is they are expected to come back stronger this year, and that will put very significant pressure on the NHS. So that's the current position. I think NHS staff have a feeling that it's relentless for them at the moment. Obviously, there is still a reasonably high number of COVID cases in hospital, as we'll come on to show you. So it is a challenging period, and it's right that we then get our heads into the issues and get ready for what's ahead. So without further ado, maybe I'll just take you now through the cases. The slides, thank you, Alex, for putting them up. What you will see there, colleagues, is that cases have been rising throughout late August into September, probably reflecting the events that have been taking place, the festivals, but also the return to school and college. So these are high rates, a little above England average, and a mixed picture in terms of some of our boroughs going up, some going down, but these are high rates compared to last summer, and they've remained high pretty much all the way through. Although, of course, the link with hospitalisation has been severely weakened by the success of the vaccine programme. But that's the current picture for Greater Manchester: 328 cases per 100,000 population, which is high by the comparative position from other periods in the pandemic. If we go on to the over 60s, that too is higher than it's been, and it's crept up since the middle of August, and that's obviously an issue that we keep a very close watch on. If we go on to the next slide, which is the breakdown by age, you will see that it's still heavily concentrated in the younger age population. But as I say, just the beginning of darkening of that slide, reflecting the increased rate amongst over 60s, and you can see that in pretty much all of our boroughs. If we go on to the next slide, please. Showing a stable position in our care homes, and I will come on actually after Kate's spoken just to talk about a particular issue with regard to care home staff, but I'll return to that. So if we could go on to the final couple of slides, please. So this is the picture with regard to hospitalisation and the numbers of people in hospital across Greater Manchester. I don't know if we could make sure people are admitted to the meeting, because it's currently over the screen, if that's okay. I don't know if Jimmy, if we could admit people who are waiting. But thank you. So what you will see there is a pretty stable position, but again, a level of hospitalisation that is still high and causing pressure, as I said, for NHS staff. So the number of admissions has crept up slightly in the latest figures. What we see there is obviously an increase in people being diagnosed with COVID within hospital. The position with regard to numbers of people actually in beds has changed, gone down slightly, but as you can see, remaining at a reasonably high rate, and has been at that kind of position for most of the summer. If we could move on to the final slide, please. This is obviously the latest position with regard to vaccine in the city region, with a high rate of coverage amongst the over 50s and particularly amongst the over 70s. And with regard to 18 to 49, huge efforts still continue to be made to encourage people to take up the vaccine, but beginning to tail off with regard to the overall percentage who've received their second vaccine. But huge amount of work continues on that, and we would like to see those rates go higher. I'll leave it there for now, but Kate, could I ask you to pick up from there, and obviously from your perspective, give the messages that you think the Greater Manchester public needs to hear, given the position that we're currently in. But I'll hand over to you, Kate.
Thank you, Andy, and good afternoon, everybody. I think the Greater Manchester position really reflects the high underlying prevalence across the northwest of England. So we're seeing that continuing high prevalence, and indeed the northwest and the northeast have their rates rising at a higher rate than other regions of England. And it's important to remember the R number that we look at, which is the, if you like, the measure by which we understand how transmission is how successful we are at reducing transmission, is showing that in the northwest of England, it ranges between 0.9 and 1.1. And 1.1 obviously means we're seeing anything greater than 1 means we're seeing uncontrolled transmission. Now, the good news, if you like, is the success of the vaccination programme in holding down hospital admissions. So we're not seeing the kind of COVID admissions that we saw during waves 2 and 3 of the pandemic. And there's a very stark relationship between the rates of admissions and the success of the vaccination programme. So that's the good news. But of course, our hospital systems, our primary care systems in particular, are dealing with a lot of non-COVID work. So any increase, even not a big spike in COVID activity, does cause significant pressure for our systems, and will do going into autumn winter. As Andy pointed out, as we go into autumn winter, obviously we also have flu, respiratory syncytial virus and norovirus. So it is going to be incredibly important to make sure everyone who is offered the flu vaccine takes up that offer of flu vaccine. And of course, this year we have extended the flu vaccine programme to teenagers, so those in secondary schools, as well as the younger children who have previously been offered the nasal flu vaccine. So flu vax take-up is going to be just as important as COVID vaccine take-up. The other, I think, concerning issue for us is clearly we're not seeing the full impact yet of the schools and, of course, our universities going back, and, of course, people returning into the workplace. So the impact we are seeing at the moment is social mixing post the so-called Freedom Day and the lifting of legal restrictions. So I think it's very important to reiterate the messages around hands, face, space and ventilation going into autumn. These are going to be incredibly important messages and measures that we can all take to try and reduce transmission. And of course, very importantly, to make sure if you have symptoms of COVID has not gone away. It is still the predominant communicable disease causing us challenges in the system. If you have the symptoms of COVID, get a PCR test and self-isolate until you get the results back. I was talking to some of our GPs yesterday, and people are turning up with coughs and saying, "It's okay, doc, it's not COVID." Well, unfortunately, it may well be. So you do need to get out and get your PCR test if you have a cough that's new, a high temperature, and obviously loss of smell sense of smell and taste, and of course some of the other symptoms around fatigue, runny nose, etc., that come with Delta variant. And don't forget that Delta variant is still highly transmissible. The other thing I would like to highlight, Andy, is whilst we are looking at really successful vaccination figures for our older age group, I think it's a very sober reminder that still 29% of the adult population in Greater Manchester is still unvaccinated. So we really must redouble our efforts over the next few weeks, not only to obviously roll out new vaccination programmes, but to make sure that our adults are double jabbed going into autumn winter. So and there is an inequality across Greater Manchester ranging from 40% in Manchester to 20% in Stockport. So a real targeting to increase uptake in those parts of Greater Manchester where it's not as good as we would like to see it yet. So getting vaccinated and really sort of complying voluntarily, being kind to each other around our public health measures are going to be really important in helping us manage the pressures going into autumn winter. Thank you.
Thanks very much indeed, Kate. Some very clear messaging there. It is the case that the government SPI-M committee do expect case numbers to rise in this period, and therefore hospitalisation to rise. So to reiterate what Kate said, the pandemic is not over, and we will be reinforcing those messages about distancing, about hand washing, about wearing face coverings required on our tram, but on other parts of the transport system we believe people should wear a mask, and that will become more and more important as we go through autumn into winter. And there are just two specific issues I wanted to raise with relation to where we are with regard to government policy as we go into this period. I was disappointed to see an announcement yesterday from the government that they will begin charging for lateral flow tests. The point at which that will happen is currently unspecified. It would not appear to be imminent, but in our view, that would be a backward step and would further impact on areas where the case rates have been highest. It never makes sense, in my view, to charge anybody for preventative tests or treatment when it comes to health, and that's why we have a free national health service. Charging for lateral flow testing, in our view, could only lead to the increased spread of the virus and indeed deepening those inequalities that we've seen all the way through this pandemic. And even raising the idea of charging for these tests may already have a deterrent effect on some people seeking a test. So the government said it will consult. I'm giving you the very clear Greater Manchester view today. There is no support in Greater Manchester for the introduction of charging for lateral flow tests as we go through the pandemic. And we would urge the government not to go down that particular path. The second issue I want to raise today, because it's very much an issue that is coming to a head, and it's the whole question of compulsory vaccination for people employed in care homes, working as carers in care home settings. Obviously, we see the figures that the position there is thankfully stable at the moment. I've expressed concerns before about this particular group of workers being singled out for compulsory vaccination. I was approached last week by somebody who works in a care home in Wigan, 15 years service as a carer, who will be made redundant tomorrow, and who has chosen not to take up the vaccine because of an adverse impact within a family member. Now, obviously, it's for different people to make their judgments about the vaccine, but I do believe it's very unfair to put people in a position where they may have concerns, but then have no ability to maintain their job if they've chosen not to be vaccinated. it is the case also that staff are leaving social care to work in the NHS where there's no such restriction. So it's hard to see the logic of this particular policy when it doesn't apply more broadly. It either shouldn't apply at all or should apply more broadly. And we've also seen there are obviously high vacancies in retail and hospitality at the moment, which could impact on social care. We estimate that there are around 2,000 people in Greater Manchester who are in the position where they may be at risk now of losing their job. And that can happen from tomorrow, because the 16th of September is the date by which people will have had to have their first vaccine if they're then to be fully vaccinated by the time of the government's deadline. We think overall amongst health and social care staff that 90%, just over 91% are vaccinated, but that still says that around 1 in 10 are not. And the government is currently consulting about whether it will extend this policy to domiciliary care. I think finally, just to say, to those 2,000 people, some of whom now are obviously at risk of losing their jobs, I wouldn't want today to go by without recognising their service to the people of Greater Manchester, the people that they've cared for. It does feel a very unfair situation to me for them to be put in this particular position, coming as it does last week after a rise in their national insurance contributions. It does feel that this is the forgotten workforce, or a workforce that's singled out for treatment that others don't get. And if there is, we will have to monitor this issue very carefully. But if we do see a loss of staff from social care, that could present challenges for some of our care homes, and we need to watch that very carefully indeed. What it does say to me is we will only have a proper solution for social care when there are proper rewards for the people who devote their lives to looking after other people's relatives. It should be at least a real living wage as a standard across the sector, and we believe that support needs to come in now if we're not to risk seeing a greater loss of staff from social care going forward with the combination of policies that have been introduced in recent weeks. So I wanted just to express our concern about that situation, about the unfairness of it, but also just to send, not to have people just leaving their jobs and nobody notice. We do notice, we do thank people for their service. We do not believe they should be in this position, and obviously we'll be monitoring this situation carefully as we move forward from here. But I'm going to leave it there, Jimmy. I'm going to hand back to you now, and obviously we're keen to hear questions from colleagues in the media. So back to you, Jimmy.
Thank you, Andy. So if I could ask colleagues from the media to raise your hand now if you want to ask a question, and I'll give it a moment for you to do so. Thanks. Thank you. So we can start, I think, with Jessica Hay. Jessica, you should be able to unmute your microphone now. If you could introduce yourself and where you're from and ask your question, please.
Hello, can you hear me okay?
Yes.
Yeah. I'm Jessica Hay from Manchester TV. Just two quick ones to Andy, if that's okay. She mentioned before with the slides with the vaccine uptake and saying that you want to see those numbers increase. What more do you think can be done to encourage this? And we've also heard that the prospect of COVID vaccines have been pushed back but could be brought back as we head more into the winter period. So I just wondered what your thoughts are in terms of COVID certificate vaccine proof for kind of large events and things like that.
Thanks, thanks, Jessica. I'm going to pass the first question to Kate, if I may. There is a huge amount of work going on to encourage young people to come forward, particularly I think the Grab a Jab campaign, which has been running all summer. But Kate, did you want to just pick up that and say what else we think we can do?
Yes, thank you, Jessica, for that question. There is a lot of work going on to target effectively the vaccination information. So this involves a lot of door-to-door, face-to-face type communication, working through peer networks, working directly with community leaders as well. So and I pay huge tribute to the insight team within our communication cell and engagement cell in Greater Manchester, so that we actually get out there, deliver vaccines at times that people feel are much more accessible and in places and locations. So, for example, I'll give you an example from my own borough. We've been taking vaccines out into the workplace so that people don't have to have time off work in order to go and, as Andy says, grab a jab, but also using events where we can do pop-up clinics as well. So a lot of use of making sure that our comms get out in the right format and using the right community and influencers to have those conversations and address, where we've got concerns about the vaccine itself, so that using trusted voices in the community to do that. So a really major push, particularly over the next few weeks, to really get into communities and geographies where vaccine uptake is not as high as we would like it to be.
And on the second part of your question, Jessica, I mean, personally, I don't see a case for any extension of that policy right now, in that people are becoming quite used now, I think, to either showing proof of vaccine or of a negative lateral flow test. And we have had requirements in place at some of the big events that have taken place in the city region over recent days, most notably Park Life. I think that is beginning to be understood by the public, being able to produce one or the other. And personally, I wouldn't want to see a major extension of that policy right now. But obviously, I think the government will have to keep these things under review as we go into the winter months. What we want to do is obviously maintain that level of freedom that people have got, and we want to support our businesses through the coming months. And therefore, all measures will have to be on the table, so to speak, to be able to do those things. But I think at this stage, I would say I wouldn't particularly support any extension of COVID certificates or vaccine passports. Okay, Jimmy.
Thank you, Andy. The next question comes from Jen Williams. Jen, you should be able now to unmute yourself. Just introduce yourself, where you're from, and ask your question, please.
Hello. I've got a question for Kate and a question for Andy, if that's okay. Oh, sorry. I'm Jen from the Manchester Evening News. Kate, I wondered if you could just summarise, I guess, what your biggest concerns are in terms of risks over the next couple of months, and how worried you are that the hospital system in particular here may not be able to cope, given the modelling that's coming out of SAGE. And Andy, I've sort of seen here and there headlines about the potential for an October circuit break, and some of my contacts have suggested that might yet surface as government policy. And given that SAGE seemed to be sort of saying, do something light, but do it sooner rather than later, I wondered what your view would be on an October circuit break to time with half term.
Thank you, Jen. I'll take your first question. Obviously, I think I'll sum up my concerns for the next few months as being complacency. I think we have become a little bit complacent post the lifting of restrictions, so we need to ditch that. And I think, following what the CMO and what SAGE have saying, we are moving into winter. We cannot be complacent and cannot think that COVID's gone away. I think it's very much around communication, and we need clear, consistent communication. I think there have been confused messages coming out nationally, in particular, that we have to try and counteract locally. So a clear, consistent messaging about what's expected and what we need to do going forward. I think I'm worried about the cumulative impact of COVID rates increasing just when flu and other viruses are coming into play, on top of the existing workload for the system of non-COVID activity, because heart attacks, strokes, other non-communicable diseases which are high prevalence in Greater Manchester, like respiratory diseases, haven't gone away. They're still there, and we need to manage those long-term conditions so we don't get acute admissions resulting as a consequence of long-term condition management not being as we would like it to be. And then lastly, my big concern is capacity in the system, which you've rightly sort of picked up on. I think it's important to remember that primary care, for example, is trying to manage the rollout of significant vaccination programs, which are big logistical exercises which no one should underestimate, but at the same time trying to respond to all the demands, rightly so, from the public around other health problems. And then if primary care is not able to cope, clearly then that impacts, for example, on A&E, on ambulance attendances, and obviously on the hospitals. And I think it's tribute to our hospital system and indeed our overall health and care system in Greater Manchester, because we operate the hospitals as one big system. That does give us a degree of resilience and ability to mutually aid. But my concern about the rise in COVID admissions is any significant rise in COVID obviously then impacts on other emergencies, other elective procedures, and particularly the elective recovery programme. So those are the big concerns for me going into autumn winter.
And thanks, Jen, for the second part of your question. I actually see quite significant practical difficulties with going to an October circuit break. In the world has changed a lot over the summer, and just to go straight back down to effectively a lockdown situation, I think will be a very difficult thing to do. It'd have a very big impact on our businesses, as I was saying a moment ago. And actually the question would be, how effective would it be if it was for 1 or 2 weeks? Would it actually create a break in the transmission sufficient to change the fundamentals? I think would be an open question, and possibly I would say unlikely to achieve what we would want it to. What I think as an alternative should be a return to more disciplined messaging. And I think this is what Kate's saying, and I want to back Kate up on this. You know, we were never convinced, as you know, Jen, about the move to allow people to choose whether or not to wear a face mask on public transport. We still think that is the wrong thing, because it's hard to put the genie back in the bottle once you've taken those measures away. But even so, I still think the best thing to do would be to, rather than talk of a plan B that's sitting in reverse, I would be saying take some of those measures out now and say that actually to plan for the winter we should be starting to get a discipline back with regard to hands, face, space, and obviously look at the potential for working from home as we go through the autumn, and obviously to take quite pragmatic decisions about all of that. So no is the answer to your question about a circuit break. I wouldn't be convinced that would be doable or even would work at this particular point in time. But I do think it means we need to get into a more disciplined position again with regard to the messaging. And I think that has been made more difficult by the whole Freedom Day rhetoric that we had a few weeks ago. As I said before, the case numbers are predicted to rise, and that means we've got to get on and plan for other things now that will make a difference to try and disrupt that. So the programme of vaccinating 12 to 15-year-olds will start next week. So we've just been discussing that today, and it will commence. It will be a school nurse-led programme, and it will commence in our secondary schools next week. Not all, but we will be working through as quickly as we can, with the aim of trying to complete by the half-term break. But I think that will be difficult, but we will move as quickly as we can on that. Of course, making sure that we have full parental consent. So that's one thing that's being done. Separately, the booster programme is now being put in place, and that will commence as soon as possible as well. So I think it's alternatives at this stage, and we need to move quickly on those alternatives, as well as increasing the general vaccination rates, as Kate was saying before.
Thank you. The next question is from Jack Anthony Dulhanty. Jack, you should be able to unmute yourself now. If you could introduce yourself, where you're from, and ask your question, please.
Hello, can you hear me?
Yes.
I'm Jack from the Mill. My question is for Andy. I know earlier on in the conference you said that the pandemic isn't over, but as we do sort of make that transition out of the pandemic and back to normal life, one of the big challenges will be the underlying health of the health service itself. What's your view on the success of the Greater Manchester Health Service, and what's your current view on the success of health devolution since 2015? And also, what sort of numbers do you use to measure that success?
Thanks, Jack. I think the challenges facing the NHS are severe, to be honest. I think this is a winter that probably we've never seen before. I know we kind of almost feel like we're saying that every year this year, but this will be different. And that's certainly the widespread feeling amongst NHS staff, who are already pretty worn out, if we're honest. And they've got, a really, really big mountain in front of them now. I went into Salford Royal earlier this summer. As I said, I was in Manchester Foundation Trust yesterday. I think that is absolutely the feeling within. But knowing them as I do, the resilience of NHS staff, they are getting ready to get us through it, and they will. I'm watching carefully ambulance response times. I've picked up some concerns about that over the summer. All of this needs to be looked at as we go through the next few months. But you asked about devolution and how we've used some of the powers that we have to help the NHS to cope. I think what we've all said over the last 18 months is that the GM system has worked as one system, where our health colleagues have supported people in social care. We've managed this as one system effectively, and I think that has been brought about because of devolution moving us very firmly in that direction. We'd already begun a programme of raising standards in our care homes pre-pandemic, and I think that has left us in a stronger position, I think, to face some of what has been thrown at our care homes. And the PPE situation was something that certainly we dealt with well as a result of our devolved status. I think it's also true that the work with our most vulnerable populations has been good, particularly the homeless population, and health colleagues working closely with colleagues in homeless teams. That has also been strong. The provision of online mental health support is something that we put in place early in the pandemic, and I know that has been an invaluable support to many people in Greater Manchester, and that too, you could say, is a product of devolution. As we move beyond Jack, I very much want to bring into being the proposal that I mentioned in my manifesto, which is moving towards a live well service in all 10 boroughs. This is in some ways learning from what we've been doing over the last 12 months, providing more everyday informal support for people to build their resilience and provide everyday mental health support. So we will be having a discussion soon at the Greater Manchester Reform Board to take that work to the next stage, in effect turning us, what is a Greater Manchester social prescribing service, into a much more extensive live well service across all of our 10 boroughs. And that is capturing some of the good things that have been done over the last 18 months, working through our community hubs. So that's where we currently are. I think there is a general feeling here that the health service is becoming more integrated with all public services. That's a positive thing, but we now need to take that to the next level if we're to really bear down on some of those inequalities that we've seen exposed over the last 18 months.
Thank you, Andy. Next question comes from Joe Harrigan. Joe, you should be able to unmute your mic. Just tell us who you are, where you're from, and ask your question, please.
Hi, can you hear me okay?
Yes.
Yeah, I can hear you, Joe.
Hi, I'm Joe from the Bolton News. Okay. Yesterday in the House of Commons, Sajid Javid didn't rule out the question of a second regional or local lockdown. Specifically, the example of Bolton was put to him by Shadow Health Secretary Jonathan Ashworth. So it's a question for Andy. Could you foresee a situation where we are faced by local lockdowns again, possibly in Bolton or elsewhere across the 10 boroughs? Would that be practicable in your view? And are there measures in place to help businesses and local services to deal with that if that arises?
Well, it's a year, isn't it, Joe, since Bolton went into a very localised lockdown of its hospitality. And I remember, sadly no longer with us now, but David Greenhalgh as leader of the council speaking out very passionately against that, in the way that it was done, in that there wasn't enough support put in place for those businesses in Bolton who were affected by that. And then, of course, we went on into the whole debate about Tier 3 in October last year. Our experience of living through all of that is that regional lockdowns have if they work at all, they have a minimal impact, and actually can create an incentive for people to spread the virus by travelling outside of areas where services are locked down. And I think that very much was what happened in the run-up to Christmas last year, where we saw hospitality open in some places and not in others. So I would say we've got to learn from all of that. Our position here is still that we are opposed to any return to regional lockdowns. Disappointed that it wasn't ruled out by the Health Secretary. Jen Williams asked me about a circuit break before. We certainly would, if that was necessary, if we needed to move in that direction through the Christmas period or the New Year, we would prefer national measures of that kind as a last resort, rather than returning to regional lockdowns, which, as I said, in our view, created real impacts for people here that I don't think were understood in Whitehall, and as a result led to the very big disagreement that we had with the government last year. And as we've seen recently, it was the Northern Health Science Alliance last week, really putting the evidence behind the differential impact of the pandemic on the north of England compared to other parts of the country. It has been substantial, and it will take us some time to recover from this, both from a sort of personal level, but also from an economic point of view as well. And any backward steps now with regard to lockdowns, I think would be very negative, be very negative indeed. So that's our position, Joe. We've got a very kind of strong position on that issue. We would much prefer sensible, disciplined, precautionary messages being put out there now around, as I said before, face coverings, distancing, further encouragement around vaccination, reminders that we are still in a pandemic, and but it can be managed now alongside the vaccination programme, because we know now that of the success of that particular programme. Of course, the one thing that we will all have to watch going into the winter is not just the number. We're showing you a slide every week here of the number of people with COVID in our hospitals. I think what we're going to have to show more as we go through the autumn and winter is all of the pressure on hospitals linked to all of the conditions that might be out there. The clinicians I was speaking to yesterday at Manchester Foundation Trust were saying that already there was evidence of a seasonal respiratory condition affecting children is very prevalent, much more so than it would be normally at this time of year. And there are more children in the Manchester Children's Hospital with respiratory conditions than would be expected at this time. And I think there's something of a warning sign there.
Thank you, Andy. Next question is from Michael Gaffney at Heart and Smooth. Michael, I'm just allowing your mic. I should also say, Michael, before you speak, this is at present the last question, unless reporters have other questions they want to ask, in which case please raise your hand But Michael, over to you. Can't currently hear you, Michael. Are you able to unmute yourself? Okay, give me a second.
It looks like it's unmuted now, Michael.
We can't hear you, Michael. I'm sorry.
Let's put your question in the chat.
Do any of the colleagues from the media have questions? In which case, please raise your hand now.
Kate, was there anything before, if we're coming to a close, anything you would like to say before we finish? Anything you think we may have missed, or anything that needs to be reinforced?
I think just those messages around maintaining your hands, face, space, ventilate. I think the point you were making, Andy, SAGE is very clear. Working from home is a better measure than any kind of local lockdown. Really, if you've got symptoms, please get tested. Do not think COVID's gone away, and any kind of new symptoms, particularly new respiratory symptoms or a cough, go and get your PCR test and self-isolate until you've had the result back. Really important to do that, because you're protecting others and you're protecting yourself as well. And clearly do take up the offer of vaccine when it comes your way. Both if you've not had your primary course, please get that completed. And obviously when you get an invitation to come for your booster, then please take up that offer of vaccination. And of course, we are rolling out the universal 12 to 15-year-old programme as well. We've had good take-up from the 16 and 17-year-olds, and a number of them have actually brought their parents along, which is really welcome.
Thanks, Kate. I just want to reinforce that. I can see, I think, Jimmy, you might have got Michael's question now. But I would just want to say, we've all enjoyed it, obviously, doing things that we've not been able to do, going to sport and music and various things over recent weeks. But the way to protect those freedoms going forward is obviously to do everything that Kate has just said, and very much hope that the public will understand that and work with us on it. One issue that hasn't come up, Jimmy, that I will just mention is the situation with, if I'm thinking about events in the city. Obviously, we have been very busy in recent weeks, and will continue to be busy throughout this month as we're seeing the return of students to our universities, which is obviously good to see. But we have a very big day coming up on the 25th of September, and obviously there is the potential of a strike on Metrolink. So all I wanted to say on that today is obviously we're encouraging both sides to get back around the table, get talks underway, and to see if we can avert a strike which would cause serious disruption in the city region on that particular weekend. But obviously we've got other events coming up after that as well. I'm pleased to say that I think both sides are getting back around the table this week. There will be further talks this week, and obviously we would be encouraging them to come to a resolution of the issues, which would obviously take away the need for any strike action. But that situation's ongoing. That's the latest I can give colleagues today, that there is a further process of talks to take place later this week. Jimmy, shall I come back to you for Michael's question?
Thank you. I do have Michael's question. He's blaming his new laptop for his difficulty speaking to us. He asks you, Andy, if you have any concerns about the cut on universal credit and how that might impact people's ability to follow the COVID rules. And I should say that this is the final question.
Yes, thank you, Michael. I'm glad you've asked that question. Myself and other mayors have written to the government to make that point. Obviously, it will just have an impact on people's day-to-day living standards, because don't forget, many people who in receipt of universal credit are in work, and hence that then might also have an impact on their ability to stay off work should they become unwell, or if asked to self isolate. So we're back in that particular problem. It feels exactly the wrong time to be, if you like, making things more difficult for people, given that we are not through this. And as Kate and I have said all the way through today, the logic is to maintain the measures that have been put in place, be they financial measures to support people through this, or indeed the other measures to prevent the spread of the virus. You know, that all of that should be kept in place all the way through this until we are out the other side, and certainly beyond this winter, because obviously for the reasons that we've given today, it's a significant challenge for the NHS, but actually for all public services. So that £20 uplift on universal credit, you know, has made a real difference for people. It has taken the pressure off people during this difficult time. Absolutely, we would urge all members of Parliament to vote in favour of the motion today that keeps that uplift in place, and you know, votes against the possibility of that £20 being withdrawn. So certainly would put that message to all Greater Manchester MPs. You know, the people here need that support, and they need that to be kept in place. There's an argument for it being kept permanently in place, but for today, let's say that should be kept in place right throughout the pandemic, certainly into the early months of next year. And I would actually argue permanently, because you know what we're seeing is the reliance on food banks, the reliance on other kinds of support. We've allowed some people within our society to have to get by on far too little, and the health consequences of that have been made very, very real and evident by the pandemic. I think building back better is a phrase that's going to have to mean something at some point, and I think it starts with people who've been hardest hit by the pandemic, those who are struggling the most. And I would say absolutely to all Greater Manchester MPs, please vote today to keep that £20 in people's pockets, because I think it's so badly needed across all of the 10 districts of Greater Manchester. Thank you to all colleagues for your questions and for your attendance, and we will see you next time. Thanks very much, everyone.